is a social problem that India is going to face. We are looking at 100 million seniors that the country has today, and this is growing very rapidly. People think of India as a young country, but we also have a senior population that is growing pretty fast. And if you look at the preparedness of our environment to care for seniors, I must say that it's a long way to go that we have. So we started Life Circle, Anant and I started Life Circle in 2013, end of 2013. It came from a personal experience. Our mother had to undergo a knee surgery, and following the surgery, when it was time for her to be discharged and recover from the surgery, we got her home and we were looking for somebody that could help us care for her. We had the family to care for her, of course, but then she needed somebody to be by her bedside 24/7. We were in Delhi, the capital of India, but it was so difficult to find reliable, good quality help who had any sense of how to help a senior recover from a condition. We're talking about post-operative surgery. We got cheated by agents who would bring people, take huge amount of money. Besides the money, the trauma that it causes, the shift causes, and the situations that you have to deal with when you already have a situation in hand was just overwhelming. So that's from the side of the seniors and their families. But if you look on the other side, some of the girls that these agents sent to us to care for our mother, we saw that what the agent was taking from us was very different from what the girl was being paid. There was no set pattern on what she's expected to do. She had no skills and hence very limited confidence and ability to deal with the situation. So we saw that here was a young person, and most often this was a very poor rural person. So we also saw that here is a part of a community, communities from across the country that are coming in search of work, being given not so fair terms of work, and there is not an ability for them to negotiate on any plane because they are at the mercy of this agent to find them next work. So we said that these are the two social challenges that we want to take on head on. So that is how Life Circle was born. Anant and I have about 20 years of experience each in healthcare, implementing policy, research, advocacy. So we said that we need to put this knowledge and experience to good use. In the 3 years, so we are in 2018 now, so in the last few years of our experience, we have provided over 3.5 lakh hours of care to seniors across 2 cities in India, in Hyderabad and Delhi. And we have worked with over 700 girls that come from across the country, mostly the poorest states of India. We recruit these girls only from training institutions, which means that they have undergone skills training provided by Government of India approved institutions. Their identity is checked, and there is a reference point to whom we can go back in the event of any challenges that we face with this individual. In working with these 700 girls, we looked at some of the challenges. So one is in terms of the specificity of their training. So the people that we were hiring were trained to be bedside assistants, general duty assistants, home health aides, but nothing about seniors or geriatrics. So that still left a gap in the sense that we work only with seniors. So we provide home nursing and caregiving services only to seniors. So we saw that when we placed these girls with seniors, they didn't have specific knowledge and skills to deal with either the hard skills or the soft skills to deal with seniors. Some had a natural flair to learn, so they picked up work over time, but they were not equipped before they went into the situation. So we decided to experiment. So we think of this as a social experiment that we are doing. So we were fortunate to find our partner in Assam. This is a huge public sector undertaking. It's an oil company called Numaligarh Refineries Limited. They are in a district called Golaghat, and we were connected to them through our partner, through the incubator of which we are a part. This is called T-Hub. It's a Government of Telangana initiative.
In the last couple of years, we are doing a lot of works, particularly in the field of skill development, women empowerment, and education, providing support for agricultural activities in this neighborhood, promoting sports.
For development in the surrounding, for improvement in environment or health or in the safety part also.
While doing this, we found few things that there were a lot of boys and girls in the category of say class 10 or class 12. What to do for them? They have not been able to go much beyond if their economic condition doesn't support them.
Education is certainly lacking in this area. That is a major reason for underdevelopment in this region. We have introduced giving some scholarships, some economic assistance.
We also have to skill them. Then we started a school of nursing, and here we are providing education to the girls free of cost. Almost about 75% of the seat is reserved for this category of people.
So that's why we have to tie up with some private agency or even government agency, whatever. We have to tie up with them so that a major trust can be done.
In a period of about year and a half, we want to empower about 300 primarily girls, so that these girls feel safe, they earn some money, can give it back to their family, look after their family.
These two partners actually helped us reach where we are today, and Numaligarh was kind enough to understand. So when the erstwhile managing director Shri Padmanabhan met us, Anant and me, in Hyderabad, he asked us what some of the challenges we faced were. So we talked to him about availability of jobs but non-availability of people, and he said that I have the exact other problem, which means I have people and I'm desperately trying to find jobs for them, because Numaligarh refinery cares a great deal for people in its surroundings. So they believe that they have a responsibility towards the community that lives around the refinery. So they do a lot of good work through their corporate social responsibility group, and he wanted us to examine if we could work with the refineries and work with the most difficult segment, according to him, which is girls who have dropped out of school, girls and young people who have dropped out of school. Within that, most importantly, girls.
ये कोर्स केयर गिवर का है, लाइफ सर्कल हेल्थ सर्विसेज, जो हमसे बुजुर्ग है, मतलब हमसे बड़े बुजुर्ग हैं, उन लोगों का सेवा करना चाहिए. जो हम लोग जो कुछ भी कर सकते हैं इस एज में वो लोग नहीं कर सकते, क्योंकि उन लोग को बहुत बीमार हो जाता है, वो लोग ठीक से खा नहीं सकते, कुछ काम नहीं कर सकते, तो उन लोग को हमें सेवा करना पड़ेगा. माँ ने मुझे बोला कि तुम वहाँ जाओ, जाकर कुछ नया सीखने को मिलेगा लाइफ में, जो हमने सीखा भी नहीं है, देखा भी नहीं है. तो मैं यहाँ आ गई. आने के बाद यहाँ बहुत कुछ सीखा भी, बहुत कुछ समझा भी.
हम लोगों का घर में तो एल्डर पर्सन नहीं है, तो इसीलिए सोच रही हूँ एल्डर पर्सन को हेल्प करने से खुद को भी खुशी मिलेगा और कुछ नया सीख भी लूँगी.
मैंने हाई सेकेंड ईयर फाइनल एग्ज़ाम दे दिया, डिग्री नहीं किया. थोड़ा सा घर में प्रॉब्लम हो गया था, इसलिए नहीं किया. जेरिएट्रिक बोला था सर ने, एल्डर पर्सन को थोड़ा सेवा करना पड़ेगा. तभी मैंने सोच लिया कि नाना नानी जैसे बहुत लोग होंगे वहाँ पर. मैंने तो बचपन में नाना नानी को नहीं देखा, इसलिए वो लोगों के भी साथ भी रहूँगी तो बेहतर लगेगा, इसलिए ही मैंने यहाँ पर सपोर्ट किया.
2014 में हाई सेकेंडरी पास किया था, तो यहाँ पे आके जो मेरा फ्रेंड्स है उन लोगों ने भी बहुत बात जानता है, तो जो मैं नहीं जानती हूँ उन लोगों ने सिखाता है, तो जो मैं जानती हूँ उन लोगों को सिखाती हूँ. तो ऐसे बहुत हेल्प हुआ है और ऐसा लग रहा है यहाँ पे आके आगे में, अभी तो बहुत पीछे है, लेकिन ऐसा लग रहा है मैम लोगों के बात सुन के बाद में जाके बहुत आज से रास्ते पे जा रही हूँ अभी, तो अच्छा पोजीशन में रहूँगी.
Boys still manage to find safe livelihoods, and it is not as much of a safety issue for them. When it comes to girls, it is an entire different game. That is how this partnership started in 2017, and we are right now where we are is we are running this 3-month-long course. This is called the Geriatric Home Health Aid course. I would say that this is probably one of the first geriatric aid courses in India. Government of India has now introduced a new skill group called the Geriatric Aid, so I'm sure there'll be more partners coming in. But we created the curriculum from the scratch. We created methodology for working with learners, adult learners and learners with not very high levels of educational attainment. So we defined methodologies that would keep them engaged in the classroom and build on what they knew, because with adults you can't teach them the way you teach kids. So it is an experiment we are doing. Our first batch has finished the 2 months of classroom and they are in the practical training segment in Hyderabad. So the way this works is we have a training center here about 30 kilometers from the refinery in a place called Bokagat, and there is a team headed by the center manager that runs this training program. They do the classroom segment. So it's a 2-month long classroom segment which has a lot of practical activity and some level of theory. And following that, these girls are taken either to Hyderabad or Delhi, where we have our operations team, and they are given the practical training. So we actually introduce them to homes of seniors where they work together with one of our old caregivers, experienced caregivers, and in the course of 1 month they gain the knowledge, skills and the ability to work with seniors, the understanding of how do you deal with seniors when you work with them in difficult situations. Yeah, we are eager to see how this goes, because what we are seeing with our first batch is that when these young girls come from rural Assam into Hyderabad, it is so many changes that they actually deal with. So first is just in terms of the environment, the place that we are sitting in here, is their home. And you will see it's just so different when it comes to a city. So things that they may probably take for granted, that you wake up to bird calls and a beautiful nature, and when you go to a city like Hyderabad, what you wake up to is dust and noise of vehicles. That's one change. Second is most of these girls are from families where people have not gone into organized work settings, so they are first generation workers in an organized workplace, so they have no idea of how to work and live within the norms set out by the organization that you work for. So that is a second struggle we face. A third one is just the communication because of language barriers, because we're talking about Assamese, which is the local language here. When it comes to Hyderabad, people speak either Hindi or Telugu. So there is a significant difference in the language, and the ability to communicate becomes quite a challenge in some cases. And the food is so different, the food habits, and given the diversity of India, Assam is almost like a different country when you compare it with Hyderabad and Telangana. So we are trying to slowly and systematically identify some of these problems, and not to mention that when some families that we place these caregivers in may not be very kind to the girls, poses another level of challenge, because we don't have a complete control on how these families behave. We have an option of pulling the caregiver out, and which is what we exercise in some cases where we see that despite repeated requests, there is no improvement in the way the caregiver is getting treated. When we started this project in August 2017, we had to take a tough call on who would do this project, whether it was Anant and me. It was not very obvious that I would do it because it was at a distance. I had never been to Assam, never worked in rural Assam. But then we had a life circle to handle, and then this social experiment that we are doing here together with NRL. So I felt more inclined to take this on, and I also love working in the Northeast. So I travel here once every month to help my team and to work with my team to see if the design that we have put in place and the pedagogy that we have put in place, for instance, is it working? Is the environment, including the hostel that these girls are staying in, the food that they are getting, is it appropriate? Should we fix something about it? I have conversations with our partners. We have many partners. It's not possible to do this work without the support of the numerous people that we have here. And the Numaligarh team and many others who they have introduced us to, they have been the backbone of this project. So these are some of the things that I do. And when I come on these visits, I also watch out for anything that is likely to stand out. For instance, this time when I was here, I had a conversation with our doctor who ran a health check for all the 28 girls in this batch. He told me that out of the 28 girls, 20 girls were anemic, and that was quite a shock to me. I realized that if these girls are anemic, they get married, they get into motherhood with low levels of hemoglobin. There's a high possibility that there would be hemorrhage during the childbirth, and we know that hemorrhage is one of the biggest reasons for maternal mortality and morbidity. So I requested the doctor to do a couple of things. One is I asked him if a prophylaxis with antihelminthics would help, and he said it would. And then he put all the anemic girls on a course of iron, and I also requested him to look at our food chart, the food that we are serving to these girls in the hostel canteen. So small things like that. So we try and see, end of the day, we don't want to just provide academic coaching to these girls and get them job ready, but we also want to use these 2 months to help them learn about their bodies, how to care better for themselves, and how do you instill that confidence in these girls to be able to handle their lives and ask for what they deserve, and have a higher expectation from life. If we can help these girls think of, I deserve much more than this, I think that's a big change that we would have made. End of the day, what we care about is that the caregiver that we are training from here, the school dropout girl that we are training and taking to Hyderabad, showing her the dream of a safe and dignified livelihood. We want to keep that promise to these girls, and I wouldn't say it's been easy. It's tough, and it has numerous challenges, so we're trying to fix them one at a time. Let's see where that gets us.